On the 10th of October, that is the World Mental Health Day, the Government of India rolled out a new initiative, a new platform to help Indians stay positive. They named it Tele-Manas, short for Tele-Mental Health Assistance and Networking across states. What is this all about? A round-the-clock mental health service that will make assistance available 24/7, especially to people in rural areas, to those who cannot really afford seeing a therapist. How exactly will this work? What does this scheme entail? And how severe is India's mental health crisis? Let's find out. Hello and welcome to Gravitas Plus. I am Gambhir. The COVID-19 pandemic may have slowed down, but another one is raging at an alarming pace: the mental health pandemic. According to the World Health Organization, the global prevalence of anxiety and depression increased by a massive 25% in the last 2 years, 25%. It further estimates that around 280 million people in the world are now suffering from depression, 280 million people. A large chunk of this figure belongs to India. Here's why I say this. According to the National Mental Health Survey, 56 million Indians suffer from depression, 38 million Indians have an anxiety disorder, 14% of Indians require mental health intervention, and over 150,000 of them take their lives every year. These figures raise a lot of concern, and what's worse, India's ability to combat this crisis is crippled. Its mental health workforce is severely understaffed. There is a massive shortage of psychiatrists and psychologists. I have some more numbers for you. According to the WHO, India has only 3 psychiatrists and psychologists for every 100,000 people. That's tragic to say the least. And experts say if the state of affairs persists, these numbers are likely to get worse. And that's where Tele-Manas comes in, a one-stop solution for all mental health issues: depression, anxiety, insomnia, lower self-esteem, or suicidal thoughts. Tele-Manas will help Indians navigate all these challenges. Let me give you a lowdown of what it is and how it will work. To start with, this program will establish 23 tele-mental health centers, with NIMHANS, Bengaluru being the nodal center. These centers will work in cohesion with IIT Bombay, the Institute of Technology, along with the National Health Systems Resource Center, NHSRC. These 2 institutes will provide technical support for the initiative. Where will the services be available? Initially, they will be offered in 20 states and union territories, and depending on how the program pans out, they will later be expanded to the rest of the country. According to reports, in the long term, the center plans to gradually operate at least 1 Tele-Manas cell in each state and union territory. And who is going to operate these cells? More than 900 counselors, psychiatrists, psychologists, and doctors from all over India. NIMHANS Bengaluru is already training them for the task. What about the services? How will they be rendered? According to reports, if you are seeking help, you can access it by calling these helpline numbers. Tele-Manas staff will be available to assist at any time of the day. And how exactly will they do this? Well, there are 3 steps involved. First, you will be connected to an interactive voice response system, or what's called the IVRS, to help identify your problem, post which you will be transferred to a trained counselor from your respective region who speaks your respective language. The second step, you will be virtually connected to a mental health specialist, a doctor, a psychologist, a psychiatrist, depending on your situation. The third step will involve in-person services or physical consultation. It will include specialists under the district mental health program or counselors from the nearest national medical college. So to put it simply, Tele-Manas will serve as the digital arm of India's overall mental health program. The aim will be to make mental health care affordable and immediate for every Indian. Now, what I'm about to say next may be controversial, but it's high time we addressed it. We don't take mental health seriously enough in India. There is a lack of awareness and sensitivity around the issue. There is also a big stigma attached to people who face these issues. I mean, how many times have you heard people tell someone who's suffering from mental health issues that there is no such thing as depression, that it's all a matter of choice. You either choose to be happy or sad. Well, this attitude does not help. It only complicates the problem further. It makes people wary about addressing the issue. This is what a recent survey revealed. 47% of Indians are highly judgmental of people perceived to have a mental illness. 26% Indians were categorized as being afraid of the mentally ill. That's not even the worst part. The survey further asked respondents to describe people with mental health issues. 47% of them used the word retard. 40% used the word crazy or mad. 38% described them as irresponsible. 36% described them as spaced out. And the worst of it all, 26% said mental health patients were probably born with a brain defect. The respondents were further asked, what should people with mental health issues do? At least 60% of the respondents said they should work on their willpower and self-discipline. 60% others wanted them to restrict their interactions so that they don't contaminate others with their issues. Those were the exact words used. Not only does this amplify the problem, it also stops people from getting treatment. Let me show you some more figures. According to data from NIMHANS, over 80% Indians do not access mental health services, either due to lack of knowledge or the fear of being stigmatized, or simply because it's too expensive. That's another challenge. The cost of mental health care. It's a bit too much for the average Indian. According to a report, the average cost of a private counseling session in any Indian metro is 1,500 rupees for an hour, with some professionals charging 2,000 to 4,000 rupees an hour. Now, say you need a weekly therapy appointment. It will cost you 6,000 rupees a month. Not every Indian can afford this. The average salary in India is around 32,000 rupees. My point is simple. Yes, stigma and lack of awareness are complicating India's mental health crisis, but so are unaffordable mental health care services. And Tele-Manas aims to address both these challenges. It plans to make these services affordable, accessible, and secure, devoid of judgment. The government's intention is very simple. Indians no longer have to struggle with their mental health issues in silence.